Hello and welcome to another edition of Mosaic, an African American Perspective. I'm your host, Deborah Milo. Hospice is care designed to provide medical and personal comfort for patients living with a life-limiting illness. Montgomery Hospice is a nonprofit organization that has been providing hospice care to people in Montgomery County for 30 years. Today, we're talking to Board Chairman, the Reverend Dr. Sterling King, and Medical Director, Dr. Jeff Coleman. Gentlemen, thank you for coming on today's show. Welcome. I appreciate you taking your time to come on.
Thank you for having us.
Thank you.
You know, I want to begin our conversation by framing it in a way that our citizens can really understand some of the basic elements of what hospice care really is, because as I mentioned in the green room, I talked to a few colleagues of mine just trying to get a random sampling, if you will, and they seem to understand one aspect of hospice, but I understand that there are other aspects of hospice. So could you kind of begin by talking about what hospice care really is? Dr. King, would you start?
Yeah, well, I think you you touched on it when you mentioned that hospice care is care that's designed for people who have reached a stage in their life where they're kind of approaching the end of it. And it's medical care, it's comfort care, it's also care to the family of the patients. And so it's not just for the patient, but also for those who love the patient and who care for the patient. And it involves the provision of medical services to persons who are at that stage of their life, and it includes medications and various medical equipment. We have 5 different categories of personnel who work with them. They're physicians, they're nurses, they're certified nurse aides, there are social workers, and there are spiritual counselors or chaplains also. And that provides a team approach to the delivery of health services to those individuals.
A team approach sounds the best way to get to accomplish what you need to accomplish.
Yes, and in addition to those professionals, we also have volunteers.
Oh, I see.
Some 300 volunteers who spend 3 days of intensive training in preparation for their work. And they provide an important adjunct service to the delivery of the hospice care, because most of our hospice, in Montgomery Hospice, most of the care is delivered actually in patients' homes.
I see.
But we deliver services in their homes, in assisted living facilities, and in nursing homes. And of course, Montgomery Hospice has the only inpatient care facility in the county, Casey House. We have 14 beds there. And that's kind of the framework.
Okay. I want to talk a little bit later more about Casey House, as a matter of fact, so I'm glad that you brought it up. Dr. Coleman, can you talk a little bit about how the hospice movement got started? Because a lot of people may not know why or how hospice came into existence. Can you share a little about that?
Well, the hospice movement got started in the 1960s. It came from England, from Dame Cicely Saunders, who found that the care that people received at the end of life was really inadequate. They still had much pain, shortness of breath, a lot of anxiety, and also that their families seemed to be almost as sick as they were for a variety of reasons too. And so she saw a need to provide a different type of care that would comfort these people towards the end of life when they were beyond cure. And so they formed the first hospice there, which eventually this movement spread to the United States, and it was mostly a volunteer movement in the 70s.
I didn't know that.
And eventually Medicare,
Right.
or the Center for Medicare and Medicaid Services, which is their parent organization of the federal government, saw the benefits of this for their beneficiaries, since they're taking care of people over the age of 65 generally, saw how helpful it was to their clients. And so they eventually established the hospice benefit in 1983.
Okay. So is there a difference between hospice care and palliative care? Can one of you or both of you speak to that?
Yes. I'm a palliative medicine specialist.
Okay.
That's what I'm board certified in. Palliative medicine is the specialty which concentrates really on the control of symptom management. We try to do meticulous symptom management for people that have diseases generally that are not curable, but things like pain, shortness of breath, nausea, vomiting, anxiety as such, and it may go beyond that. But as well as paying attention to the family, also who may be participating in their care, because we know that in addition to providing care for the patient, that their family is very important also and can affect their overall health.
Oh, yeah. And we find that in a lot of settings and situations when a loved one has had to go into, let's just say, rehabilitative facility or the hospital for a surgery, anything like that, I think the family, it's very important that the family be engaged with the caregivers to the highest degree.
Yeah. Now, hospice itself is actually part of palliative medicine.
I see.
You can get palliative care anywhere along the continuum of medicine. Most people, young people that are acute care, getting acute care if you go into the office for a cold or something like that, you don't need palliative medicine, but as you get older and you get more chronic diseases, that may need some symptom relief or management or things that are going to linger and last, then sometimes palliative medicine may be a benefit for you. Now, with hospice care, hospice is actually just a part of palliative medicine. It is more of it's a benefit, and it concentrates really on people that are at the end of life. Generally, we define it as, depending on your insurance carrier or even non-insurance carrier for that matter,
Of course.
as people that have a life expectancy of 6 months or less.
Okay, okay. So now talk about the types of services that are actually offered. You were starting to talk a little bit about the types of services as far as family support. Talk about those specifically, what types of services. Dr. King, can you speak to that?
Yes. Well, the services, there's a medical component, as
Right.
Dr. Coleman was mentioning. Persons who come into Montgomery Hospice will receive the necessary medical care. That includes medication and any of the other equipment that also would be required for the delivery of those services. Depending on where the patient is, of course, if the patient is at the Casey House, that's a more intensive kind of situation. But one of the important things about Montgomery Hospice is that the patient has access to nursing care 24 hours a day, 7 days a week.
Oh, I see.
So that any time of the day or the night, the patient or a family member can make contact with a nurse and receive information that might be helpful to whatever particular condition is in need of being responded to.
Talk a little bit about Montgomery Hospice as a whole. I'm trying to understand how Montgomery Hospice works. I'm trying to understand what all goes involved to being Montgomery Hospice, because I think Casey House is the standalone facility. Is that correct?
Yes.
So Montgomery Hospice is what? Is it the umbrella? Is it the...
Yeah, Montgomery Hospice, we have 251 employees. We have a board of directors. Currently we have 21 active members of the board of directors.
And you're the chairman of the board.
I serve as chair of the board, yes.
Okay.
And Constitution bylaws provide for up to a maximum of 30 members of the board. Of course, our board operates like most boards and most organizations. We also do quite a bit of our work through various committees. We have 5 standing committees, and we have 1 ad hoc committee. We have the governance committee, executive committee, a major gifts and philanthropy committee, and we mentioned the finance. We have also, the ad hoc committee involves strategic planning. We do that once every 3 years. It's a triennial experience. We meet 6 times a year, every other month. And during the months when we are not, when the board itself is not meeting, the various committees are in session. And so is sort of from a structural standpoint. We have excellent leadership at the hospice. Montgomery Hospice has been blessed to have an executive director, president and executive director who has a tremendous background in this area. And
You talk about Ann Mitchell?
Ann Mitchell, yes.
Oh,
yes.
she's a wonderful woman, yes.
Yes, and we have the senior staff, including Dr. Coleman, who's the medical director, but we have others who share in that senior management leadership
I see.
at the hospice. And so Montgomery Hospice is about providing care with competence and the CCs, the competence and compassion.
Competence and compassion, okay.
In all of those categories, those 5 categories that I mentioned, these are people who are well trained in the areas of medicine, nursing, certified nurse, nurse's aide, the spiritual counselors. These are all people who are trained at that level, and social workers. And so they have the training and the certification.
Okay.
And the team effort brings all of these skills together in a way that we think serves to benefit the patient, which is a key focus, but also the family members of the patient, because that's also a part of the delivery.
I agree with you. It's a very important part. Dr. Coleman, let me ask you, is a doctor's referral needed in order for someone to enter the Montgomery Hospice?
At some point, a doctor's referral is needed, but anyone can be referred to hospice. Sometimes we have families that ask if their loved one is eligible. They can
Yes.
call up our admissions department or our 800 number or whatever number that they find. Sometimes they find us on Twitter and Facebook.
Really?
Yes.
So social
And-
media is a component
yes,
that's used?
It can be.
I see.
And we will often contact the doctor for you to find out if you're actually a person that's eligible. So we will take care of that, and we'll come out, we'll make a visit, and see that do you qualify for these benefits or not. And if not, and if you do qualify, of course, we'll contact your doctor, we'll enroll you in our hospice program. If you don't qualify, hopefully we'll help find some other resources for you so that you can get steered in the right direction.
Let me ask you, how do you know, or I should say, when the decision is made for someone to enter a hospice program, who should make that decision? Should it be the patient? Should it be the actual people, the family members caring for that person? I know that's a
The
unusual question.
usually when I am presented with that question, I usually ask the surprise question, which is, if you got a call in 6 months that your loved one had died, would you be surprised?
Ah, I see. Okay.
You know, and or would you be surprised? I mean, do you think you've reached that point? And that generally, if you answer no, you wouldn't be surprised.
Right.
Then you're probably eligible, or you
Okay.
probably should be referred.
I
We
see.
do that with physicians, nurse practitioners, family members as well. A patient or a potential referral, they're of course able to make that decision themselves as long as they have capacity to decide.
I see.
But also, and sometimes family members don't like that because they don't want to let that person go, and that's a difficult decision.
Of course it is, absolutely. Gentlemen, we're going to take a quick break and come back and finish having our discussion about Montgomery Hospice. For those of you who've just tuned in, you're watching Mosaic, an African American Perspective. I'm Deborah Milo, and I'm talking to Dr. Sterling King and Dr. Jeff Coleman of Montgomery Hospice. After a short break, we'll be back with more conversation.
I love taking care of my mom. It wasn't easy at first. She learned how to better communicate her needs.
And you learned how to not ignore yours.
I discovered how to make healthier meals.
And I discovered how much I enjoyed them.
Becoming a caregiver is a learning experience for everyone. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.
Welcome back to Mosaic, an African American Perspective. I'm here with Montgomery Hospice colleagues, Board Chairman, the Reverend Dr. Sterling King, and Medical Director, Dr. Jeff Coleman. Gentlemen, before we went to break, we were talking a little bit about if all hospice is the same, and I have to ask that question to you, Dr. Coleman. Is all hospice the same?
No, all hospice care is not the same. I mean, there are a variety of hospices in Montgomery County. Of course, we consider ourselves the best. Well,
Of course.
we don't consider ourselves the best. We know we're the best.
Okay.
Right?
Yes, amen.
Yes. There you go.
Yeah,
There you
okay,
go.
yeah. But we have several advantages over many others because in addition to providing medical, spiritual, psychosocial care, which all hospices are mandated to provide.
Right.
We also have our volunteers are very dedicated. We also provide bereavement services to people after their loved ones die, and we do that for 13 months. We have a very extensive
Oh my.
and
Okay.
well-trained bereavement department that does that. And it's not only for the benefit of patient families, but it's actually anyone in the county can use this benefit. Let's say if someone has a tragic auto accident in their
Right.
family,
Right.
of course they didn't get hospice benefits, but that person can call our bereavement department and we can either get them in a group or we can see them in counseling or whatever we may do to follow up. So that's one of the other advantages that we have. Also, we all have our inpatient unit. We have the only inpatient unit in the county, which is Casey House,
Casey
which
House,
is a
right.
14-bed inpatient unit.
Right.
And generally I consider that like a hospital for hospice patients.
I see.
And I won't say that it's a hospital with all the alarms and noises and lights and things like that because it's a very homey setting. However, it is intensive care for people that are very sick, that need aggressive symptom management that can't be provided in any other setting at that time.
Okay.
They need things that just cannot be done at home, and that's what we do. It's not a place for them to go and die
Exactly.
necessarily. The idea is to go and get their symptoms managed, get their pain under control or their breathing under control or their agitation or whatever it is, and then get them on to the next setting, whether it's home, back to the nursing home, assisted living facility, whatever.
I want to shift gears. Oh, I'm sorry,
No,
Dr.
just,
King, you were about to say.
Yeah, I was just coupling what Dr. Coleman just mentioned. Throughout this whole process, Montgomery Hospice staff attempts to find out or to establish as early as possible from the patient and the family what is most important to the patient at that stage of the journey, of life's journey. And then all of the efforts, all of the inputs are really directed towards trying to maximize on achieving those goals that the patient himself or herself, along with their family members, would establish. And so that the provision of medical care and all, that's an important part of that.
Yes.
But there are other, as you mentioned, psychosocial aspects that feed into that.
And I'm glad that you said that because I want to delve into that just a bit. For some reason, we all have cultural norms within our, cultural communities, and I want to talk a little bit about that. Can you explain or share a little bit about why African Americans seem to be a little more reluctant or hesitant to utilize hospice care when it comes to dealing with a life situation like that?
I think there are some historical legacies that provide a partial explanation, coupled with the fact that we, as a community, tend to be fairly strong in our religious beliefs.
We are.
And so the notion that it is God who gives and God who takes away life, and who teaches us how to say, "Blessed be the name of the Lord," I think helps to impose a little bit of a psychological restraint on some people's thinking when it comes to that part. And I think an interesting part of this is that this is where it sort of gets linked in a way with this whole notion of hope as well, because I think as a people, we believe that there is always an opportunity and the likelihood or the possibility that the sun will come up tomorrow.
Exactly.
And for some people, the notion of of going into a hospice suggests that you're heading to the sunset.
Right.
And we like to look at the notion of the rising of the sun. The sun is going to rise again.
Yeah, we don't believe that hospice care is the end of life necessarily, but we try to emphasize that it's a better quality of life.
That's what I wanted to hear you
For
say.
hopefully for people, especially among people that are afraid of trying it because they think that their doctors, their nurse practitioners or whoever, their family even, is giving up on them. And this is not about giving up. It's trying to make them more comfortable and giving them hope. And in fact, in some cases, actually hospice care tends to be better than regular care that you may receive traditionally. There have been several studies that show that sometimes people entering into hospice care actually live longer than those that we continue to go through various conventional care like radiation and chemotherapy, in particular for lung cancer. And so, and it's probably because they just get a little more attention. They get a little more tender loving care, TLC,
The TLC
along
aspect.
the way,
Right.
which goes a long way.
It's
You know,
compassion.
yeah.
It's compassion.
And that's what we do. And people haven't figured that out. They're afraid of the dying part. They're afraid that we are taking away their hope of the sunrise tomorrow.
Yeah.
And we're trying to just give them a better sunrise the next day.
And see, I think that that's something that the average person on the street, if you will, may not know that component about hospice care, because you hear hospice care and you immediately right. Oh no, all the bells and whistles go off. Oh God, we're going to die now. And from the research that I've done, that's not it. That's not it. It is about easing the journey, as it were, but it's also about, as you said, helping the family, offering the spiritual component, as well as looking at a sunrise as opposed to a sunset. And I just don't think that's something that most people are aware of. So I'm glad to hear you explain that and clarify that. I do want to talk a little bit about Casey House. Can you share a bit more? And I know we're shifting gears here, but I want to make sure we talk about that a bit more. Can you talk about Casey House just a bit?
Yeah. Casey House is our inpatient unit. It's a 14-bed unit that we have for people that need acute symptom management. As I said before, they need pain management.
Right.
They have nausea and vomiting, shortness of breath, agitation or anxiety, or specialized wound care. There are other things too that cannot be provided in another setting. They can't be done at home or the nursing home, and we have staff there that is well trained in providing these things. Casey House is not, and we call it Casey House for a reason, because it looks more like a home than anything else. It's a very comfortable setting for people. All the rooms are single rooms, and patients can come and stay. The families can come and stay. I don't encourage that a lot, because I want them to get enough sleep and be healthy.
Of course.
Also,
Of course.
but so that they can come and stay and be with their loved ones, and they can do it kind of in a tranquil setting. There's a beautiful garden out back. We have volunteers. We have music. We have volunteers to do hand massage, which is very relaxing. We try to provide some complementary therapies for people that are typically not provided by many hospices. So in that setting, as well as at home too. But so that's what Casey House is for. It's not a place for people just to go and die and get packed off to a funeral home.
That's right.
It's really for you to get your symptoms under control and to go back to where you were.
What I do hear you're saying is peace, tranquility, and the ability to keep moving along the path that is going to work for you to some degree. Before we go today, I wanted to ask a little bit, what do you see in the future for Montgomery Hospice? And I'm going to direct that question to you, Dr. King.
I see Montgomery Hospice continuing to provide high quality care for people who are approaching the end of their life. I see a continuing level of involvement of volunteers in addition to the staff. We have highly trained staff in those 5 areas that I mentioned.
Yes.
Physicians, nurses, certified nurse assistants, social workers, and the chaplains or the spiritual counselors. I also I see the information about hospice, what it is and what it does, is being really extended increasingly in the African American community.
Okay.
We have been involved. Montgomery Hospice has been involved in the last within the last 3 years in some rather extensive outreach into the Black community here in Montgomery County through churches, through health fairs, various educational venues, and so I think a part of what the future holds is our continuing to extend this informational bridge, if you will, into our community, so that the more people become familiar with it and come to understand that it's not just a place where you go to die,
Right.
but a place where you actually go. And the place may very well be in your home,
Right.
because we have the vast majority of our health services, in fact, are delivered in people's homes, and so as we become more aware of that, I think this whole notion of hope, a desire of the heart with the expectation that it's going to be fulfilled. That is, you're gonna, if you have a need for this kind of service, you can then rest with confidence that the people who will be providing those services are people who are highly trained and who have a spirit of compassion about them, and they will be able to meet you, quote, where you are and help to maintain that stage of your life's experiences with a high degree of quality.
And with that, gentlemen, I want to thank you both for coming on today's show and being such great guests. I hope to have you back soon so we can expound further about the subject.
A pleasure.
Thank you for having us.
Unfortunately, that's about all we have time for today. I want to thank our guests, the Reverend Dr. Sterling King and Dr. Jeff Coleman from Montgomery Hospice. I'm Deborah Milo. Please join us again next month for another edition of Mosaic, an African American Perspective. Till next time, make it a thoughtful day.
I love taking care of my mom. It wasn't easy at first. She learned how to better communicate her needs.
And you learned how to not ignore yours.
I discovered how to make healthier meals.
And I discovered how much I enjoyed them.
Becoming a caregiver is a learning experience for everyone. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.
Oh, look, a redhead. Staring contest. You still got it. I know.
Come alive with the forest.
The dad was cute.
You were looking right at us. Visit discovertheforest.org to find a forest near you.
Last summer, my new dad took me on vacation. First, we went deep sea fishing.
I'm so proud of you, son.
Then, we went on Thunder Shark 3 times.
You don't have to be perfect to be a perfect parent. Thousands of kids in foster care will take you just as you are.